Hi everyone, my name is Dr. Trish Harkins, reporting for Room Now from ACR 2024. Today I have the absolute pleasure of being joined by Professor Barry O'Shea, a consultant rheumatologist and professor at Trinity College Dublin, Ireland. Today we're going to discuss his abstract 1440 entitled Significant Factors Identified for Carotid Doppler Use, Ultrasound Use in Axial Spondyloarthritis Patients Without Conventional Cardiovascular Risk Factors. So firstly, thank you so much, Professor O'Shea, for joining us today. To begin, I just want to know, what was the inspiration for your group study?
So thank you very much for giving us the chance. So this work is largely done by my colleague, Dr. Brona Deneen. So it's a pleasure to present it on her behalf. So as you are probably well aware, EULAR have told us that we really need to screen for subclinical cardiovascular disease in various forms of inflammatory arthritis, axial spondyloarthritis being no different. So we were interested in trying to figure out exactly what is the role of carotid Dopplers in this. It's not really feasible to be doing carotid Dopplers on an entire cohort. So we felt if we could examine this in a little bit more detail, we might shed some light on it. So we went to our clinic in St. James's Hospital and we took out our axial SpA patients that had no history of cardiovascular disease or significant risks for it. And then we put them through a carotid Doppler, specifically looking for their carotid intima media thickness to see as a pointer towards carotid artery disease. It was a small sort of proof of concept idea. There was only 30 in the entire cohort that we did this, but these were asymptomatic, well patients with no risks. So they all went off and had their carotid Dopplers, and a little over a third, so 11 of the cohort had abnormal carotid intimal media thickness. So 11 abnormal, 19 normal. So then we examined these in a little bit more detail, looking at seeing if we could get any predictors for what might guide us towards identifying these patients earlier. So some were maybe obvious, but it was reassuring that those patients that had higher blood pressure in the cohort that were abnormal versus normal, more abnormal cholesterol and lipid profile were the ones that pointed out. And also another useful clinical indicator in our clinic is the waist-hip ratio. So patients that we would think would be a pointer towards cardiovascular disease, and they were the ones that turned out to have normal carotid ultrasound. We had a couple, like anything research, there was a couple of maybe more unusual findings that we need to examine a little bit further. We thought, or we presumed, and maybe you shouldn't ever do that, we presumed that the cohort that would turn out to have abnormal carotid Dopplers would have maybe a strong family history of cardiovascular disease. In fact, it was the other way around. It was the normal cohort where that was identified. So we need to examine that. The other bit of a red herring was we presumed maybe it would be the cohort with the longer disease duration. But again, that was the other way around. It was the patients with the normal carotid Dopplers that had the longer disease duration. So it was interesting. So, like any good research, I think it's given us some good information, but thrown up some more questions that we need to work on.
And did you look at any laboratory parameters, like look at inflammation, CRP, ESR, any kind of BASDI scores or anything like that?
Yeah, so we had CRP on the entire cohort, and again, maybe thinking there might be a difference between those with a high inflammatory burden, so high CRP. Again, there was no difference. We had the various indices that are frequently used to assess these patients, their BASDI questionnaire, and probably a better marker of disease activity, the ASDAS. But again, there was no difference. So it doesn't seem to be a feature of disease activity. The other features we looked at, obviously, frequently we assess a BASFI, so functional index, and a metrology index, a BASMI. Again, maybe thinking that it might reflect longer disease duration, more impaired function. But there was actually no difference between the BASMI and the BASFI scores in the patients that had normal and abnormal carotids on their ultrasound.
And I suppose moving on from that, do you guys have a plan to expand to a larger cohort, or what's the future plans for the research?
Yeah, so this was done on our own in our own unit on a sort of a pilot group. So to give us a feeling of where we should go with it, we have a national registry in Ireland with a number of different centres that are still actively recruiting. So there certainly will be the opportunity to roll it out to bigger cohorts, because it'd be nice to bulk up this numbers and see if it's reproducible. Other things we'd like to look at was obviously other indicators or markers for cardiovascular disease. Coronary CTs would be interesting, very interesting. In fact, can be difficult to get in some institutions, so we may have to come up with some kind of research question and see if we can get some funding for that, because it'd be really nice to take this in another modality, not just carotids, but seeing what their coronary arteries are like.
Absolutely. Well, thank you so much for talking to us today. So guys, that was abstract 1440, and follow us all on Room Now for further coverage of ACR 2024.